HIPAA Risk Advisor is specifically designed to meet the needs of the small medical practice. We wanted to put this brief video together to help small practices understand what they should know regarding the HIPAA security rule with these top 5 facts. Fact number 1, size doesn't matter. No matter how small a particular medical practice is, they're still vulnerable to data breaches and HIPAA privacy complaints, and so the HIPAA security rule applies to covered entities and business associates in the same way, no matter what their size, and the HIPAA security rule is an essential part of the Meaningful Use program. So why have data breaches against healthcare organizations increased 125% over the last 5 years? Well, on the black market, your medical information is worth 10 times more than your credit card number. Protected health information is a popular target because it allows attackers to commit financial and medical fraud. Attackers don't just target electronic files containing EPHI. Because of the value of this data, paper records and X-rays are also targets. The HIPAA security rule requires covered entities to implement policies and procedures, train workforce members who work with EPHI, and perform an annual security risk assessment. There are additional requirements, but all have the goal of establishing that everything is being done to protect EPHI. Okay, HIPAA security fact number 2. Your EHR provider's HIPAA compliance doesn't equal yours. Your practice has probably selected a cloud-based EHR provider who has successfully demonstrated compliance with the HIPAA security rule. That's a necessary success factor, but it's not sufficient. You see, compliance involves more than just technical safeguards for EPHI data, but also essential physical and administrative safeguards. In fact, it's the administrative safeguards position of the HIPAA security rule that requires covered entities and business associates perform an annual security risk assessment. Fact number 3. If your medical practice becomes the victim of a data breach, you'll have to notify the authorities as well as all of your patients per the breach notification rule. If you have some time, Google HIPAA Wall of Shame. The top link will take you to the HHS and OCR website, where details on every data breach involving more than 500 records is displayed. It's important to realize that such data breaches are most likely accompanied by a formal complaint to HHS and the Office of Civil Rights, or OCR, that enforces the HIPAA security rule. Here's a sample OCR letter. And as you can see, a risk assessment is required, along with documented security policies and procedures, a risk analysis, security awareness training for employees, along with a number of other pieces of evidence. And the medical practice receiving this letter only has 20 days to respond. Fact number 4. If the OCR finds that you're out of compliance, your medical practice could be subject to fines. And these fines can range anywhere between $100,000 and $50,000 per breach or even per record, with a maximum fine of up to $1.5 million per year. And those are just the fines. Potential jail sentences are also possible outcomes. Number 5. Undergoing an annual security risk assessment is essential for achieving HIPAA compliance. In fact, the administrative safeguards provision of the security rule states a risk assessment should be an ongoing process to regularly reevaluate potential risks to EPHI. So when you've established an ongoing security risk assessment process with documented security policies and procedures and employee training, you're demonstrating to the OCR that you're doing your best to protect EPHI. HIPAA Risk Advisor helps you meet all of these essentials while helping you reduce the chance of a data breach happening in the first place. HIPAA Risk Advisor provides a web-based portal with sample policies and procedures as well as training materials, an online security risk assessment, and a detailed security risk analysis report. Additionally, HIPAA Risk Advisor subscribers are assigned a dedicated HIPAA security consultant to help them review their security risk assessment and navigate the complexities of the HIPAA security rule. To find out more or get started right now, go to HIPAARiskAdvisor.com.